And with BC's vaccine program ramping up, you may have some questions about which one is most effective or if you need both doses of the vaccine to be protected.
Joining us live now to answer those questions and more is family physician Dr. Birinder Narang. Thank you for joining us, Dr. Narang.
Thanks for having me this evening.
All right, let's jump right into it. We have a question from Liz on Facebook. She wants to know, why are they changing second doses to 4 months? Why are we now waiting 4 months until you get that second dose? She says the trial stipulated 21 and 28 day.
Yeah, so I think it's important to understand when the trial is set up by design, what they report is a minimum vaccine interval. So what that means is 21 days was the minimum for Pfizer and 28 days was the minimum for the Moderna vaccine. As we've been learning more now, we're well into it. We have to look back and understand these trials were done last summer. So we're learning more about how in the real world they're being effective. And so Dr. Henry had said that this is based on Canadian data and international data, especially places like Scotland and Israel that are well into the vaccination program. And that's what's being used to inform this change.
All right, this one from Helen asking, 66 years old, major surgery in 2 weeks. Can I get the vaccine before then?
So if you have a surgery coming up in 2 weeks and you're 66, I don't believe that you would be eligible yet based on your age. We do know that still it is going to be the age-based recommendations. And in about 2 weeks we're still going to be starting to vaccinate the 80-plus-year-old community, which starts on March 15th. In anticipation of surgery, though, what I would worry about is that we know that you may have some temporary side effects, but the closer you are to surgery, the last thing you would want is to have the surgery canceled because of a side effect that might settle anyway, but then the surgeon or the anesthetist might want to delay it. So I would recommend until you've recovered from the surgery to get it then.
Okay, and Dr. Narang, learning today everyone eligible in BC should have a shot by July now. Are you surprised by the decision to accelerate the vaccination timeline here in BC?
No, I think that's wonderful. I think that we're all waiting to move on with our lives and what is the next part of it. And we know that while we can see this light at the end of the tunnel, Dr. Henry framed it in a way of what is it? We have to balance the vaccination supply, what the impact of COVID is on society itself, and what is our capacity for the medical system. So I think that moving it up allows us to maintain that capacity, but now that one part, the societal part, it allows us to actually get back to things sooner.
Okay, I want to go back to something you mentioned in a previous question. This one from Andrea asking about any further info on severe side effects from the vaccine. I know you touched on it.
Yeah, so I know that I believe today that they announced that we're up to 275,000 roughly doses given in BC. We know that there have been some severe side effects such as anaphylaxis, and that's expected. Whenever you're having a mass vaccination program, we expect that some people will have allergies. But what we are seeing, all the side effects we're seeing are what's expected. Most of them are going to be sore arm, flu-like illness. They might come a couple of days later, even up to a week later. But this is what's expected, and they're resolving with simple treatments. No one in BC, as far as I know, that's been immunized has died from the vaccine, and everyone that has had a severe reaction has been treated appropriately and have now recovered very quickly.
Important to make that clear. A lot of misinformation out there right now. Mike asks, we just heard the vaccine made by AstraZeneca is not recommended for seniors over the age of 65. He wants to know why. Has there not been enough testing? Is it something else?
So that recommendation comes out of the trial data, which didn't have a lot of people in that over 65-year age group included in the trial. So while we have some real-world data showing that has been effective, we don't have enough from the trials themselves for the National Immunization Committee to confidently recommend that. But that could change. That's where we're at right now on March 1st. But we know how quickly things can change.
Okay, this one from Lyle asking, is the Pfizer second dose the same as the first, i.e. the same amount, the same material?
Yes, and that it is the same dose. They're both given intramuscularly, generally in your deltoid, which is the upper part of your arm here, as we get a lot of our vaccinations. So yeah, same process.
Okay.
Now, Therese is asking, I don't know if you have the answer to this or not, and I don't know if anyone does. Once I get booked for the first shot, do I automatically get booked in for the second shot?
No, and I feel that that's something that's subject to change. I can speak from my own personal experience. When I first got my first vaccine, it was still at that 21 to 28 day range that I was expecting my second shot, and it was canceled, and I was rebooked. And so I feel that everyone has to prepare that. Once you book in, let's say there's another freak storm that interferes with a delivery, everything is subject to change. So I think that we all have to be, we've all been so patient up until now that we need to just maintain that patience, even though we know it's getting harder.
Okay, this one from Sandra, who says she's 94. If you've had COVID-19, how long should we wait before getting the vaccine?
Yeah, that's a great question. And what we do know is the current recommendations in BC is that if you have had COVID, that you should give at least about a 3-month window before getting your vaccination. Part of that is because we do know that once you have had an infection and recovered from it, that we expect that you have some temporary immunity from the COVID virus. And so that way we can maximize everyone who hasn't had that exposure or had those antibodies already circulating have an opportunity to get it.
Now, there's a lot of talk about the differences between the 3 vaccines, and I know you touched on this yesterday on your own social media. Should people be worried about getting one vaccine over another? Should they be trying to, fight for a Pfizer over a Moderna or something else?
Yeah, I think that there's the term out there called vaccine shopping, and I think we want to do our best to avoid that because what we do know is we have trial data which suggests one thing, but now because we have been delayed, I don't want to say it's a blessing, but we have the opportunity to use the learnings from around the world to inform what we're doing. And for example, and what I was looking up over the weekend, Scotland has vaccinated up to 1/3 of their population right now, and what they've seen is with the Pfizer, Moderna, and AstraZeneca vaccine, both are close to 100% at preventing severe illness and death. And so that's what's really important here. If I get the coronavirus, but to me it affects me as a cold, I'm okay with that. What I want to make sure is that I'm not going to end up in ICU.
Fair enough. Okay, this is a good question from Angelo, wondering, once I'm vaccinated, and let's talk about first shot, second shot, am I immune to COVID-19?
Yeah, so I mean, that's a difficult question to answer because when you talk about being immune, you want to know, are you talking about at that point? So once you get your first shot, we do expect it to take a few weeks. So what we're seeing is in that 2 to 3 week ranges where from that we're seeing that people are getting up to that 90% protection. So I would say you're 90% immune, but does that mean then that you can go and change your behaviors? Not so much. And can I tell you right now that 6 months or 10 months from now that you're going to have that same immunity? I can't say that either.
Okay, we have 2 questions here that are kind of similar. One person talking about heart and thyroid conditions, another person talking about a transplant, both asking if they should get the vaccine. Can you talk about some of the reasons maybe people shouldn't get it or should?
Sure. So I think before I answer that, I should qualify. Please do talk to a healthcare provider, whether it's your primary care doctor or if you have a nurse practitioner or a specialist that's looking after you, because now you have an opportunity to ask those questions. So generally, I won't be able to give you specific advice, but what we can tell you is that most people can get the vaccine. With people who have immunosuppressed conditions, if they're on immunosuppressants or for some reason their own immune system is not functioning, then we do warn them that their immune response might not be as robust as someone who has a fully competent immune system. And so there is that risk, but we don't worry that they're necessarily at higher risk from the vaccine. One thing that we need to be clear is these vaccines cannot give you COVID.
Okay, Dr. Birinder Narang, thank you so much. And if we didn't get to all of your questions, I know there are a few about, I'm a certain age, when can I actually get the shot? You can head to cbc.ca/BC for more information on that. Thank you, Doctor, for your time tonight.
Yeah. Thanks for having me. Have a good night.